Welcome to Concussion Stories, a Lifeyana podcast series filled with hope. I'm here to let you know that you are not alone in your concussion recovery. I'm Melanie, and I spent more than 6 years experimenting, training, and learning in order to heal myself from a very bad case of post-concussion syndrome. And today, I feel better than ever before. In Concussion Stories, we dig deep while discussing hopeful stories of recovery as well as the hard stuff in the messy middle. If you're struggling to focus, be sure to take breaks. Down in the description of each episode, you can find a table of contents in case you want to skip ahead. Let's dive right in. Welcome to yet another episode with Dr. Ramon Diaz-Arrastia. As a leading researcher in the field of traumatic brain injury and a practicing neurologist, he has so much to share with you about concussion and post-concussion syndrome diagnosis and recovery. If you haven't listened to the first episode yet, I recommend you do that first to get a better understanding of everything our guest is talking about. Without further ado, let's hear Dr. Ramon Diaz-Arrastia. So I wanted to ask you one other thing that's very closely related to what we just discussed. You and your colleagues composed quite an extensive list of potential negative consequences of wrong estimates of TBI severity. So on the one hand, you describe overestimation, which can lead to, for example, a fear of the future, right? And adaptation of unnecessary illness behavior. And when I read this, I could absolutely relate to this because when different doctors told me that my brain damage was beyond repair and that I had to learn to live with my debilitating symptoms, I tumbled into depression. And I wanted to ask you, what role do you feel that hope, so not false hope, but the possibility of hope, or taking it away entirely, has in post-concussion recovery consultations by doctors?
Well, gosh, I mean, hope has a fundamental role, frankly, in all of medicine, right? I think someone who, for example, has a diagnosis of cancer, for example, I mean, there have been many studies done on this. People who are hopeful tend to live longer. They tend to have a higher quality of life. So that's something that's inherent to humanity. And I think here we're delving outside of my expertise and into philosophy or religion or whatever. But I mean, clearly, I think any of us who is in medicine and is involved in managing and treating sick people have to recognize that you cannot take hope away from people. I mean, hope is just a fundamental feature of humanity, and we all need that. Now, having said that, I think in neurology and in brain injury medicine, there's actually good reasons for hope, right? The brain is frankly a very remarkable organ in the way that it works and the way that it's designed and the capability that it has for repair and recovery and plasticity. It's actually quite remarkable. And I think here it's most remarkably seen in something I was talking about earlier, which is people with severe brain injuries, right? So, people that come in after a very severe automobile accident or motorcycle accident, they have large areas of hemorrhage in their brain. Their intracranial pressure goes up. They need neurosurgical procedures. They need a lot of invasive monitoring, etc. Somewhere about 20% of those people make a full recovery, meaning that within 6 months to a year, they are back to doing exactly what they were doing before in their life, right? If they were a PhD student in physics, they are back to studying very very high level science, right? That's very remarkable to see. And you look in their brain, I mean, their MRI still looks terrible, right? They still have areas of scarring in important parts of the brain. But you see, how is this person doing so well when their MRI looks so terrible? And I think the answer to that is that, well, there is remarkable redundancy and plasticity that's sort of built into to brain function. And that doesn't happen all the time, but it happens enough of the time that it's certainly very, very worthwhile and critical, giving hope. And of course, in people with milder injuries, the likelihood of a good outcome is even better.
Yes, yes, indeed. It's in fact the things that you just mentioned are the things that exactly gave me hope in the end after losing it from all the consultations with specialists. I found hope in a book that described brain injury recovery in patients with so much more severe injuries than I had.
I mean, there are several of these books that have been written. I'm not sure the one that you're referring to, but there was a very famous case in the United States many years ago, I think when I was still a resident in New York City, of the Central Park jogger. I don't know if you know that story, but this was a young woman who worked in the financial industry, and this was in the 1980s in New York City, which there was a lot of crime and a lot of violence, and she was jogging in Central Park, and she was assaulted and raped and had a very severe brain injury, and was in a coma for over a month and had a very, very prolonged recovery, rehabilitation for many months, etc. But over time, and it took her several years, but over time, she made it essentially a complete recovery. She didn't remember anything about the assault or her hospitalization, right? That is all. She wasn't her brain was so injured that she wasn't forming any memory during that. But she wrote a book about her experiences, and it's a very dramatic book, I think, talking about the process of her recovery, etc. But there have been others. I mean, there have been other people. Many of them I've met personally, not all, whose stories are incredible in terms of it really humbles you to know about what the capacity of the brain can do to recover, and obviously the resilience that many people have.
Yes, yeah, it's so wonderful what the brain can do and how surprising it is with regard to how much it can change and adapt. And I was even the most surprised back when I was learning all of this about how other centers of your brain can take over function that has been lost by certain centers. That was when I decided, like, okay, this is going to work for me. I'm going to use this. And that's exactly the things that also, for example, tens of thousands of dollars costing clinics in the US also are basing their treatments on. And it's the thing that I used also in order to recover. So one of the principles is neuroplasticity and even neurogenesis, which you can stimulate by yourself. So yeah, is this something that you use in practice as well, that you mention to your patients?
To be honest, because brain injury is so common, and um, and it's primarily an unmet medical need, meaning that as neurologists, neurosurgeons, rehabilitation specialists, we actually do not have therapies that are scientifically evident and evidence-based basis proven to work and to improve outcomes. Unfortunately, that has led, because there's this large demand, right? And there are many individuals who are struggling to recover from these brain injuries. That has led, um, many clinics who have popped up, frankly, all over the world, right, promising uh, alternative therapies, right, which some of which may work and some of which may not. So I think that's another message that I think is really important. Um, Obviously, you know, as human beings, we are very inclined for magical thinking. Let's put it this way, which is part of the same need that we have for hope, right? We are inclined to magical thinking, and that works some of the time, but frankly, it's not as effective as the scientific method, right? The scientific method, humanity, we've used the scientific method only for about 200 years, which is a speck of time, a blink of an eye in terms of the time of our history in this planet. But really, the scientific method is what is going to get us out of this morass, right? It's what's going to allow us to truly have effective therapies, the way it's worked in other areas of medicine. So I think that's another message that I would think that the audience to this podcast should listen in on, is to stick to things. Obviously, you need physicians, you need medical specialists who do provide hope, because frankly there is a lot of hope to be administered, but also who are focused on therapies that actually are supported by science and are supported by evidence, rather than there's a lot of stuff out there that just isn't.
Yeah, I agree.
Right.
And I think that, okay, oftentimes in the field of traumatic brain injury, it's hard, if you're going through it right now, to wait for science to catch up with what we already can assume based on what has already been proven in several research papers, for example, but not has been peer reviewed enough and consolidated into new protocols, and wait for it until we really try. So that's the thing that I did for my recovery. I researched so much, I read so much papers, and then based on what I saw coming into existence, I used that and applied it. And that's what helped me.
And I would certainly encourage anyone who has the ability, but not everybody has the ability, to enroll in clinical trials, right? Because that's ultimately how we're going to work our way out of this morass, right? And there are many clinical trials ongoing, and I think if people live in a community where there's a major university, a major research center going on, I think that's something I would definitely encourage.
That's a really good suggestion. Yes. Can I just switch to one more topic that a lot of us have trouble with, and that's sleep. So last year, you co-published an article in which you wrote that sleep disorders affect over half of mild traumatic brain injury patients. And in your study, you compared, I think, biomarkers of neurodegeneration and cognitive function with sleep quality in soldiers with post-concussion syndrome, right? So long-term mild traumatic brain injury.
Yeah. Sleep medicine is a very hot area right now, and it has been for the last few years. We're learning a lot about just the basic neurobiology of sleep, how normal sleep is controlled, and what is the function of sleep. And it's frankly very, very exciting science. And there have been really revolutionary discoveries of that in the last several years. So the bottom line is that's inducing sleep and maintaining sleep involves a complex neurobiological circuitry, right? And the brain nuclei, the brain regions that are involved in this, are generally at the base of the brain in a part of the brain called the hypothalamus, which is, and we've known for a long time, is a part of the brain that is very commonly injured in traumatic brain injury, right? And obviously we know that patients with traumatic brain injury, one of the most common complaints that they have is problems with sleep, right? They have problems with getting to sleep, right? They say, I go to bed, but I toss and turn for 2-3 hours before I finally go to sleep. Some have problems maintaining sleep, saying I go to bed and I eventually fall asleep, and then I wake up at 3 in the morning and cannot go back to sleep. They have problems feeling sleepy during the day because they're not getting sleep at the regular time. And the other thing that we know about sleep is that it's critical to entrain the circadian rhythms in the body. Right? So there are much of normal physiology is circadian, right? It happens at certain times of the day, sometimes happens at day, sometimes it happens at night, and maintaining that normal circadian regularity is really critical, right? If you may be asleep for 8, 10 hours a day, but if you're not sleeping at in the right cycles, you're not really getting the benefits from sleep. And many of the uh, hormones and neurotransmitters and other physiological processes that work to maintain healthy brain functioning and certainly work to sustain recovery from an injury are made during sleep, right? And I think the ones we know more about is growth hormone, the somatotropic axis. So it turns out growth hormone is released generally in the early hours of the morning, right? And it's an pulsatile release, usually between 3 a.m. to 5 a.m. somewhere in there. It's associated with periods of REM sleep, and people who are not getting good enough sleep are not getting enough growth hormone and other benefits of the somatotropic axis being released. So sleep is hugely important, uh, and the other area that is very very active area of research is that sleep turns out to be really important in clearing basically the brain's refuse, right? So aggregated proteins or other things that the brain needs to get rid of, they are mostly eliminated during sleep, right? There's a recent discovery of the lymphatic system in the brain, right? That in fact there are pathways by the brain, just like there is in every other organ, to get rid of dysfunctional proteins or other things of this sort, and that's mostly active during sleep. And people who are not sleeping well tend to have problems in aggregating, in sort of accumulating these toxic brain proteins, and that appears to be a big problem in dementia and Alzheimer's disease, and probably a big problem in traumatic brain injury as well. So frankly, I mean, our practice in my clinic is we always pay a great deal of attention to how our patients with TBI are sleeping. Frankly, the majority of them are not sleeping well, and intervening to help them get better sleep is frankly often a very effective intervention. And we're very liberal about doing sleep studies where we can actually use EEG and other physiologic assessments to measure their sleep and their stages of sleep. And if they have sleep apnea, that can be treated. If they have other kinds of sleep disorders, those can be treated as well. Not always, but when it can be treated, that can have a big impact.
This is something that I completely recognize from my own experience as well. So when I was recovering, right from the onset of my symptoms, it was about 1.5 weeks after my injury. I started experiencing very vivid dreams and nightmares during the day and in the night. So my circadian rhythm was completely gone. And every time I woke up, I felt like I had already gone through a complete day of horror. And my dreams were so vivid, so I could remember every second almost. I don't know if I remember every second, but it felt like it. And then I first had to get rid of all of those memories and get rid of all of the emotions that came over me, and then start the day. And it's this downward spiral. Everything is getting out of control because of that. And once I started sleep therapy, it was so much easier to get a grip on my symptoms and to have energy again, also to move forward. So I strongly recommend for everyone to also start with this, because it's one of the primal, of course, recovery processes of our brains.
There's good data that the use of melatonin, right? So melatonin is the body's natural hormone that this hypothalamic brain circuitry uses to induce sleep, and it is available as a nutritional supplement in most countries, and there's good data that the use of melatonin can help improve people's sleep after TBI, and not in every situation, but in enough of them to be certainly a worthwhile thing to try. And it's a very simple thing.
Yes, it is. And it's something that I think, well, in my experience, I don't know what you think, but I didn't want to take it for too long because I didn't want my body to produce less and less of it because I was already giving it. So then I replaced it for valerian root, and that helped me sleep as well. So it's a plant. But it doesn't help for everyone. I want to thank you for your time, and especially for your dedication, your insights, everything that you just shared with us. I feel that this is going to be so valuable for a lot of listeners, and it's even been a bit healing for me as well, because after the fact, it's so good to hear the stories, these people who are really advancing the field and helping us get a better home in the medical area. So thank you for your work.
Yeah, and again, congratulations for putting this together. I know that you've talked with Dr. Moss and you've talked to Lindsay Wilson. I think you've already been able to collect really many of the thought leaders and intellectual leaders of the brain injury field. So that's terrific. Congratulations for this project that you've launched yourself on.
Thank you very much. Well, it's not for me, it's for all of our listeners. So I hope it helps them.
Now I would love to hear from you. What do you take away from this episode? Is there something that you can apply to your life right away? Head on over to lifeyana.com and leave your comment now. And if you want to hear and read more concussion stories, actionable steps, and inspiration, be sure to subscribe to the Lifeyana email list while you're there, so that you never miss out on new materials we constantly make for you. If you want to support this podcast, head on over to patreon.com/Concussion Stories. Thank you for listening to this Concussion Stories episode by Lifeyana. May you be well and may you be happy.